Okay, in today's video, I want to talk about the absolute best way to solve the root cause of your knee pain. Because a lot of people that see me as a non-surgical orthopedic specialist, they're not looking to manage their pain. So there is a time and a place to manage pain, and that's typically in the acute phase of an injury. So you really get banged up, your knee hurts. Classic conventional wisdom is, hey, ice it, take some anti-inflammatory medications, shut it down so it can heal, and then hopefully it heals. But what if the knee pain persists? What if you've been in the management mode for way too long? Because management, we start to get into a point that people are taking those meds not just for a couple days, they're taking them for days on end, weeks on end, months on end, and now it just becomes routine. So they're taking anti-inflammatory medications, maybe they're even taking painkillers, but they're taking something to target that pain so they can keep moving in life, being functional. So on the surface, as I've talked about before, there's not anything inherently wrong with that. That's why we have these medications, so people don't suffer. Under the surface, though, if we keep managing the symptom level of the pain without getting to the root cause of the pain, then that very thing that we're trying to manage, the pain, and not the underlying tissue injury, continues to progress and gets worse. So today what I want to talk through is, how do you get to that root cause? Number one, I think you have to see the right professional. So a lot of people are trying to DIY the treatment of their own knee or their shoulder or hip or whatever it is, and there's, again, on the surface, nothing wrong with that. I like people that are engaged in their health, trying to solve the problem. So maybe they've tried some stretches, they've tried some exercises, they've found some videos that have helped them and worked through a number of things, but it hasn't quite solved it. They're still in that management mode, it's not quite solved, knee's still bothering them, still getting in the way of the activities, might be giving them other symptoms and warning signs as I've talked about in other videos, like swelling of the knee, night pain, reduced range of motion. But if you've been living with that long enough, and I want to set up this, like, what's long enough? When we look at an injury and how the body heals, if you hear any injury reports, typically they're going to say, hey, that athlete's out 4 to 6 weeks, 6 to 8 weeks, some time frame like that. And why do they say that? Because there's 3 phases that the body has to work through once it's injured. In the acute phase, once you're injured, you get inflamed. With that inflammation usually comes pain and aches and swelling. And again, that swelling and that pain is designed into your body through this mechanistic process to ideally slow you down for a bit, give you the time and space to heal. But if we don't give it the time and space to heal, then we don't really heal a tissue. It heals partially or it doesn't heal at all, and we're just right back on top of it with activity. So again, as most people have noticed, and myself included, now that I'm in my 40s, I don't heal as quick as I used to. Right? So there's a lot of things that I do for quicker recovery, and I'll share more of those fun secrets and science and tech in the future video. But at the end of the day, the body needs that time and space to heal. If we don't give it the time and space to heal, it doesn't. When we get right back on it, it injures that tissue more, or it doesn't, again, just give it the opportunity to heal completely. So if you've done the things yourself, now most people are, hey, they might be working with their personal trainer. They might be working with a physical therapist. Ideally, you get to the point where you have a clear diagnosis. And it's staggering how many people come into my office that have worked with great trainers, physical therapists. They've probably been told what the suspected diagnosis is, but it's not really clear to the patient. And if we don't have that clarity about what the injury is, what the root cause is, it's not going to make as much sense to try to fix the problem or why we need to stay out of different activities. So you need to see the right professional. And sometimes the right professional has different tools to diagnose the problem. Like in my office, I use musculoskeletal ultrasound. This is a tool that now we can put on you live, move this body part, and look at what is going on under the surface. We can look at the ligaments, the tendons, we can look at a meniscus in a knee, other structures in the shoulder, moving it dynamically to see really what's going on in the motion. Because other studies that I get are very important, and let's just walk through them. So x-rays are very important. X-rays give us the ability to look at bones here. Okay, so if we look at a knee model, for example, an x-ray is going to give us a view of the alignment, which is important. It's going to give us a view of the space between the bones, which is important. And at the end of the day, it's limited, though, to show some of these soft tissues like the ligament, the meniscus inside the knee, the ligaments deep inside the knee. So x-rays have some drawbacks in that we can't see soft tissue really well. But x-rays are important, again, to look at, hey, what What is the alignment of this knee? What's the space left that the cartilage is providing in the knee? And if we don't get the information we need, or from a clinical suspicion standpoint, next study we're probably going to move to is an MRI. Because an MRI allows us to look at those soft tissue structures and see the degree or severity of the injury that then helps us align the right tool to treat it. So x-rays, MRIs, and what I talked about previously, which is that dynamic musculoskeletal ultrasound. So this is where we can move you, see things, because the interesting thing is I've had x-rays that look pretty normal. We get a follow-up MRI because we have a suspicion, and maybe that cartilage doesn't look as normal as that x-ray shows. So I've had a number of patients say, been told like they have really good space in their knees based on x-rays. We get an MRI, however, and it could show, like this model shows, almost a full thickness defect here. That red on this model kind of eroded through that cartilage, and we couldn't pick that up on an x-ray alone, so the MRI was needed. Or, for instance, in a shoulder rotator cuff injury, somebody could get a static MRI with their arm at their side not moving in an MRI, but when we put an ultrasound transducer on them and we move them through a range of motion, we could see that tendon kind of open up and peel apart. So we could find a partial tear that wasn't even maybe seen on the MRI. So again, we have great technology and tools to get to that root cause. And I think the stumbling block maybe is just wishing, hoping that the injury is going to heal in time. But when we frame this out 6 to 8 weeks, you've been working through a progression of things, trying to heal it on your own. Maybe you're seeing a good professional trainer, physical therapist. They've worked through that with you. It's time for diagnosis. It's really time for diagnostics. We need to get one of those studies to get clarity on it, because once we have clarity, so once you're seeing the right professional, once we have the right tool to diagnose the problem and have clarity about what the actual tissue injury is, then we can apply certain treatments to that with more precision. That's likely to treat it better, get you back to the things you like doing faster, and it's just going to time collapse that whole struggle that a lot of people are in when the injury is just not getting better, and it's getting in the way of the life you want to live. So when I look at it, the old saying is the ounce of prevention is better than the pound of cure. Well, that's kind of how I look at this too. It's like if we're earlier in the game and the problem has persisted and it's gone through 4 weeks or 6 weeks or 8 weeks and it's not getting better, you've tried the tools, it is time to see a professional who can really diagnose it down to that root cause, to stack the right treatments in front of it that get that injury treated, get you rehabbed accordingly to get back to the thing you like doing, because that's an important transition step. For a lot of people, we can do treatments to effectively get the pain to go away, but maybe they've become deconditioned to the activity they like to do. So every one of my patients is going to see one of my colleagues for physical therapy or specific, sport-specific training to get them back to that level that they need to be at to return to it safely. So today, I hope this helped thinking through pain management versus root cause treatment, okay? Because pain management, again, not bad on the surface, right? People criticize, a lot of things in our country for the amount of medications we use, and it is quite a bit. I think we want to move beyond that to, let's just not manage the pain, let's get to the root cause, let's see the right professional, get the prevention in place you need before you have a more significant injury that's going to sideline you probably for a lot longer. So hopefully that video gave you a good overview. If you're dealing with a knee injury, a hip injury, a shoulder injury, what are the diagnostics tools that we commonly use in orthopedics to get to that root cause? And if nobody's done that for you, that's a great starting point to find ideally an orthopedic specialist, non-surgical orthopedic specialist, somebody that can dig in, order the right tests, get you that root cause information, and then map out the best treatment for you. So hopefully that connected for some of you out there as what to do next in your path to getting through the injury and back to what you love. If you like this video, like it, and subscribe if you want more content like this. And if you have comments, drop them in the comments below, and hopefully my team and I can jump in there and answer some questions for you.